I'm Dr. Kavitha Chintala, Clinical Director and Senior Pediatric Interventional Cardiologist, Care Hospitals, Hyderabad. If you have a child or someone you love suffering from a congenital heart defect, you may want to know how this can be prevented. In this video, I will try to provide you with the best possible information regarding how to prevent a congenital heart defect. Congenital heart defects are defects that are present by birth. So it is a deformity that has happened while the baby is being formed inside the womb. Most often, unfortunately, the cause may not be very evident, and in 85% of the cases, the causes are multifactorial, meaning more than one cause is responsible, and the typical identifiable causes could be an underlying genetic problem, an environmental exposure, or some maternal identifiable reasons. How to prevent heart disease once one child has heart defect, how to decrease the risk for your next child. There are, unfortunately, it's not an absolute, means of preventing heart disease in all babies, but we can do certain precautions in every pregnancy in order to decrease the risk. So number one, maintaining a healthy lifestyle is very important. So adequate walking, maintaining a good diet is always good for pregnancy and also to prevent the birth defects. You need to avoid being overweight because we have identified that obesity is a risk factor for congenital heart disease. So maintaining an adequate weight pre-pregnancy and during pregnancy is very important. Another lifestyle measure that you can take is to avoid alcohol, to avoid smoking, and to avoid drug use. This is pertaining to both the mother and the father of the baby. Another measure that we can all take is to avoid over-the-counter medications, which is taking non-prescription medications or taking medications before pregnancy, which is at the time of conception, and during early pregnancy without consulting your doctor. The other things that can be done is make sure that you have had your rubella vaccine, because rubella is known to increase congenital heart disease in fetuses and babies. The other precautions you can take is folic acid. These are a vitamin supplement, folate supplement what we call. This is one way that we know that this decreases the risk of heart disease. In addition to decreasing the risk for neural tube defects, this is one medicine that can decrease your risk for congenital heart disease. So this is prescribed in all pregnancies. The ones that have had one child with congenital heart disease, these mothers are recommended to take folic acid 3 to 6 months prior conception. So this has to be pre-conception folic acid. The other thing that I would recommend is to seek genetic counseling. When there is a baby in the family with heart disease, or either the parents have a heart disease or there's a first degree relative with a heart disease, obtaining a proper genetic counseling is important, because here there will be some testing done and they will be able to identify the risk in your future pregnancy or the current pregnancy. So it is very important to prevent heart disease and get a proper thorough genetic counseling. Thank you very much.